Suboxone while pregnant, what you should know. Pregnancy is a special period in a woman's life. Many changes occur, both physically and emotionally. There are some pregnant women who struggle with addiction. If you are pregnant and struggling with addiction, you may wonder if it is safe to take Suboxone. If you're expecting and want to get clean, then Suboxone may be an option for you. This video will answer your questions about Suboxone, how it can help with addiction during pregnancy, and what other questions you may have. Suboxone is a medication for treating addiction by reducing opioid withdrawal symptoms and cravings. It has two active ingredients, buprenorphine, an opioid partial agonist, and naloxone, an opioid antagonist. Buprenorphine binds to the same opioid receptors in the brain as other opioids, such as heroin or oxycodone. However, it produces weaker effects than full agonists and has a lower potential for abuse. Naloxone, on the other hand, blocks the effects of opioids. Suboxone isn't your typical addiction recovery medication. It works effectively with behavioral therapies and counseling to provide a holistic approach to addiction recovery, with a dual diagnosis treatment, meaning that you will be treated for your addiction and any underlying mental health conditions. Suboxone can help you achieve sobriety and maintain it long-term. Suboxone is thought to be safe for pregnant women. As of now, Suboxone is considered a Category B medication, which means it lacks adequate human studies. However, the medical community mostly believes that the risk of untreated opioid use disorder (OUD) is far greater than using Suboxone during pregnancy. Because Suboxone combats addiction, it's often necessary for pregnant women taking Suboxone to continue doing so throughout their pregnancy to prevent relapse. Neonatal abstinence syndrome, or NAS, is a group of problems that can occur in a newborn exposed to addictive, illegal, or prescription medication while in the womb. Symptoms of NAS can range from mild to severe, typically beginning within the first few days after birth. The most common symptoms of NAS include fussiness, tremors, poor feeding, rapid breathing, irritability. Although NAS is treatable, most babies born with this condition must stay in the hospital for an additional period. In addition, nearly half of these infants may require medication to ease their symptoms. Although Suboxone may be a safe and effective treatment option for pregnant women struggling with addiction, it is crucial to speak with your doctor about your options before deciding which one is best for you during pregnancy. Some alternatives to Suboxone during pregnancy include methadone, buprenorphine, and naltrexone. Consulting with a medical professional before taking any medication during pregnancy is crucial, as the risks can be high. However, Suboxone is considered safe for pregnant women when other options have failed and the benefits outweigh the risks. Though methadone is more successful in lessening NAS symptoms, it can be challenging to obtain and needs consistent observation. Likewise, buprenorphine and naltrexone are safe for pregnant women and just as effective against addiction or NAS symptoms. The choice between Suboxone and these alternatives rests with you and your Suboxone doctor because there is no definitive solution. During your assessment in determining your Suboxone treatment plan, your Suboxone doctor will consider your pregnancy. Suboxone doses may be lowered during pregnancy to reduce the chance of withdrawal symptoms in the newborn. Your certified Suboxone doctor will prescribe the amount of Suboxone necessary to prevent withdrawal symptoms and minimize opioid cravings based on what is optimal for your condition. Although taking the minimal dose can help reduce side effects, sometimes it's not enough to prevent withdrawal symptoms and cravings. Requiring a daily dosage of Suboxone will be different for everyone and is essential in the early stages of treatment for ensuring control over your OUD. It is not considered safe to stop Suboxone during pregnancy as it can lead to relapse. Tapering off Suboxone may be recommended by your Suboxone doctor in some cases, as it will be most beneficial due to the long-lasting effects of Suboxone. A Suboxone taper schedule will help to slowly reduce your Suboxone dosage over time to minimize withdrawal symptoms. Abruptly stopping treatment will result in unpleasant opioid withdrawal symptoms, which can be very dangerous for you and your baby. If you or someone you know is pregnant and struggling with an addiction, reach out to a Suboxone doctor today. Suboxone treatment can help save lives. To learn more about Suboxone during pregnancy and to find a Suboxone doctor in your area, contact SuboxoneDoctor.com today. Our providers accept most insurances, including Medicare, and put your priorities on the top of our list. We understand pregnancy is an extremely sensitive time, and we will help you in any way possible. Suboxone treatment can make all the difference. At Suboxone Doctor, we will create a safe space for you and your baby. We can connect you with quality providers who can guide you during this pivotal time and create a comprehensive treatment plan tailored to you. Contact us today and take the first steps to your new future.